It is important to have the attitude of success and positivity when pursuing a goal. The late Milton Berle, he's a comedian and an actor, once said, "If opportunity doesn't knock, build a door." And this is important, especially to me, because it represents all of the students in this program. We were selected and given the opportunity to be here, and now we create opportunities for us to succeed out of the ones that we have been given. My name is Evan Bradshaw. This is my first year in ISM, and I'm a senior at Frisco High School, and I'm studying anesthesiology and kind of pediatric anesthesiology at the same time. My mission in ISM this year is to explore and further my interest in medicine and to create professional relationships within the medical field, and to learn kind of patient etiquette and how to interact with patients. I hope to learn about skills necessary to help people lead healthy lives, and I hope to develop my work ethic and determination throughout this program so that I can help myself have a successful career in whatever I choose, may it be medicine or anything else. So to also learn some life skills along with the skills in medicine. So first through my interviews. My first interview was with Dr. Tabitha Foster, and she was very passionate, and this is interesting because this was my first learning experience in ISM and anesthesia, so I kind of got to learn from how early should I leave to what kind of procedures happen in the operating room. So it was a big learning experience all around. And she was really very passionate. I liked talking to her because she had a real passion for what she does, and she really loves what she does. And she works with general anesthesia, and she kind of rotates through different hospitals. So one thing she talked about a lot was that she had kind of a hard experience in medical school. So she talked about kind of balancing a ton of different things in medical school, and she gave great advice for getting through medical school, and because it's so difficult and the work, the schedule is so difficult with that, with so many different things coming together, that you kind of have to be able to do a balancing act. So she talked a lot about that. And also she talked about having a high responsibility. And one thing that she said that I hadn't heard anyone else say in any of my other interviews or before that was that the anesthesiologist is one of the only professions where you have direct contact with the patient, whereas, for example, a surgeon has nurses, a pediatrician has nurses, and almost everyone else has someone in between that can help spot a mistake that you make. But the anesthesiologist has themselves and a vial of drugs and the patient, and that's it. And those drugs can also be extremely lethal at times. So one thing she talked about was you have to have a very high responsibility and very high personal integrity for yourself, because you have to be extremely vigilant. That's the word that the Anesthesiologist Association uses, is the big characteristic is vigilance, because you're the only one who has control over the patient. And so I thought that was really interesting. I hadn't heard that before. And then also she loves anesthesia because like it says up there, you're constantly learning new things, and it's constantly a changing field with new technology coming out all the time and new studies coming out all the time. So it's constantly changing, and you're constantly learning new things. So I think that's interesting to me, because it's not, and that's probably medicine in general. You're constantly learning new things and constantly discovering new things. So I thought that was interesting as well. And like I said, this was a good experience overall, because it was just my first learning experience of how to get through my interviews. So using that knowledge of how to conduct the interviews, I went on to my second interview, and I loved this interview because he also had a really great passion for what he does and great passion for life. He's a cardiac anesthesiologist, so he works with a lot of specialty surgeons. And so basically his story was that he was a pediatrician for 5 years, a very successful pediatrician, he said, but then he grew increasingly unhappy, and he just wasn't happy with his life, and so he switched to anesthesia. And he said it was difficult for him to go back to, you have to be a resident for I think 3 years, and which is basically like an internship sort of. And so he said it was difficult going back to residency with all these younger people when he's like between 35 and 40, with all these younger people because they're so much more vibrant than he was. But obviously he kept his vivacity with him, and he was really, really passionate about what he does. And this helps me kind of solidify the fact that you don't have, nothing is set in stone, basically. And I like to kind of stick to a plan whenever I figure out a plan. I like to stick to that. I don't like changing whatever I do. So this kind of helped me grasp the fact that whatever you do, you don't have to stick to that. And obviously he was extremely happy, and he was such a great person to talk to. So obviously that switch helped him, and if he had stayed on the path that he was, he wouldn't be nearly as happy as he was when I interviewed him. So that helps me kind of grasp the fact that you don't have to stay doing what you're doing if you're unhappy. So and that's really what I'm here to do, is I'm here to discover if I like medicine and see if I want to do that further down the road. So I also started seeing some themes comparing to my last interview, and he talked about how there's an instant gratification when it comes to anesthesia, whereas if you're a physician, just a regular doctor that you go get a flu shot from, you're seeing your patients over a period of years. And anesthesia, you give them a drug and you see instant gratification within the patient. So a lot of the anesthesiologists that I talk to love that instant gratification because they see instant results, and they're usually impatient, which I am too. So they like to see that instant gratification in the patient. And then my third interview was with Dr. Kevin King, and he was an independent anesthesiologist, and most anesthesiologists these days I've kind of seen are not independent. They work in groups, and but he is an independent. He works with people doing cataract surgery, so really minor anesthesia. He just kind of gets them all loopy, and then they do the surgery, and they're out 5 minutes later. But so the anesthesia isn't really difficult for him, but he stressed that the most difficult part was the business side, because he's independent. He has to do all the billing. He has to do all the nitpicky, kind of really tedious and confusing financial side with billing and insurance companies and all that. So he really didn't like that, and he really stressed that he really didn't like that. And that's one thing I did notice. If you're in a group of anesthesiologists, you don't have to deal with that. So I think that's probably the better route to go, especially if you're doing higher level anesthesia rather than just his kind of simple cataract surgery anesthesia. But he makes it work, and he said that having a business background would definitely help. So I've been kind of toying with the option of doing both a business and medicine background, which from my observations, that would definitely help, because medicine is becoming increasingly corporate, and with a business background you might be able to work your way into the corporate structure of medicine these days. And so my fourth interview, Dr. Scott McGraw, I couldn't find a picture of him for the life of me, but he started a anesthesia group called Pinnacle Anesthesia Consultants, and he started that I think about 15 years ago-ish, and now it's grown to be one of the biggest groups of anesthesiologists around North Texas. And he said he was on the ground floor of that, and so he is involved with the administrative side. Also, he's administrative in his hospital. I think he's at Las Colinas and Baylor, Coppell, or something like that. And so he's involved with the administrative side of those hospitals, and so that was interesting to me. He said some of the hardest things about his job was managing administrative expectations and having to deal with scheduling other anesthesiologists within the hospital. So there's a running theme that the hardest thing about anesthesiology is not anesthesiology. It's whatever is associated in the background that you don't even really think about. And so also in this interview I saw reoccurring themes, like a very inconsistent schedule, as you could imagine. Some people are on call and they get called in at random times during the night, and so it's a very inconsistent schedule. Again, the instant gratification. And also I see that medicine and anesthesia in general is becoming increasingly corporate run, and corporate run by businesses. And so you may be working for someone who has never even been an anesthesiologist. So that tells me that having a business background may be able to get your foot in the door with higher level jobs because it's so corporate run. And then my last interview, this is my mentor. His name is Dr. Jeff Steiner, and he works at Children's Medical down in Dallas. And he was my favorite interview. He is a pediatric anesthesiologist. Obviously, he works at Children's, so he's pediatrics, and I really liked him because anyone who's working with kids and who loves working with kids just has to have a certain quality of life and a certain extremely positive outlook. And he just, I don't know, we just clicked really well. I really, really loved talking to him. And he has an MBA as well, so he's a DO MBA. He said, I'm not really sure what the difference between DO and MD are, but he said he's sent me a few things that on the difference between those. So I'm eager to look into that to see what exactly the differences are. But he's also an MBA, so he has been able to work his way into the corporate structure of, especially of a corporate structure of a hospital. And so I asked him why he likes pediatrics and what got him into it. And he likes pediatrics, he said, because it's not the kid's fault that they're there. Like, if you're treating an adult that they've been smoking or drinking for 10 years and they're there to get whatever surgery done on their lungs or liver or whatever, it's their fault. But these kids aren't there because it's their fault. It's just they can't help it. And so they still have, and a lot of them still have a positive outlook on life. It's just they can't help the situation that they're in. So he likes pediatrics for that reason. And also he stressed to, quote, play the game. And by that he meant, and this was advice when I asked him what advice would he give himself back in medical school. And he said, play the game, and that means do what medical schools are looking for. And he was talking about getting into medical school and getting like residency. And that basically means make your resume look fat, make it look like a Christmas tree, and do what they're expecting and what they want. Don't, it's hard to kind of just swoop in and do whatever you want. You have to have a plan. And by play the game, he meant you have to have a plan of how you're going to go about it and make yourself look appealing to the medical schools and make yourself look appealing to hospitals and employers. And so I picked him mainly because he has a business experience. He has an MBA. So like I said, I'm toying with the idea of doing a combination of both if I'm studying later in life. And also in my research, I grew increasingly interested in pediatrics, anesthesia, and overall, like I said, we just clicked, and I just really loved talking to him. And I'm running kind of long here, so I'll just go quickly. But my themes throughout the interviews that I saw overall, patients are the absolute priority, which obviously, hopefully, I would hope so in a medical situation that that's the case. But a highly variable schedule, increasingly corporate run, like I said, and they do, these people do like what they do because it gives them immediate results, like I said. Quickly through these research assessments, this first one I started becoming interested in anesthesiology because there's a psychological aspect behind it, and this just talked about how even using different words when you're talking to the patients can change their pain levels after the surgery. So using certain words like prick or injection can like mess with their psyche a little bit, so that or the research shows anyway. So I thought that was interesting. And then the third one, this is my favorite research to do. And this is about how certain volatile anesthesia can help and hurt infant brains. That's what neonatal means. And basically, just a summary, right? Is there a little, yeah, right there, that's called an ischemia in the brain. That's where it has insufficient blood flow. And so volatile anesthesia right here have been shown to provide neuroprotection against ischemia, but also they've been shown to lead to neural degeneration, or neural apoptosis is what it's called. And so there's kind of a ongoing debate, a recent debate that's just started. And so this is one of the main debates that I've seen in anesthesia in my research. It's one of the only ongoing debates that I've seen in my research. And so people are kind of, and there's not much study that has been done. There are studies conducting right now because it takes so long to see the neural degenerative process. It takes so long to analyze that. There are studies going on, so that was an interesting one because it was, like I said, it was the first debate and the first kind of argument that I've seen within anesthesia. So the last one is just talked about basically how different children anesthesia, pediatric anesthesia is different from adults, and a lot of times children, this last one, a lot of times children are being treated in hospitals that are built for adults, and luckily in Dallas there's so many hospitals that are all over the place, and we have a children's medical, and that's where Dr. Steiner works. It's really nice there. Olivia knows, she's not here, but she knows it's really nice there. And so basically these children are a lot of times being treated in hospitals built for adults, so that research assessment talked about, or that article talked about how best to prepare operating rooms and how best to deal with issues that are special to children. And so basically themes throughout the research, extremely technical, and it's constantly changing, and multidimensional. By that basically means there are different aspects to look at anesthesiology, many different aspects to look at it through pediatrics, through different theories and things like that. So why I chose it, I have a family history, and mostly bottom line, I just thought it was really cool. I still think it's really cool. And my goals in ISM, like I said in the mission statement, gain experience, learn about medicine in general and meet contacts, and then after ISM, I want to try to go to UT, Hookham, and then try to go to medical school. Those are my plans, but also very subject to change. And that's it. Thank you.